a follow-up conversation with Tony Sanchez, who was featured in our show tonight. Tony is the director of the Office of Recovery Transformation at the Georgia Department of Behavioral Health and Developmental Disabilities. Tony, it is great to see you again. Thank you for being with us.
Thank you for the opportunity to be on the show, Jay. It is good to see you as well.
You know, what I loved about when we met is that you were very honest with us about your journey. And as we say, you have true lived experience. So for the people watching right now, if they know or love someone with opioid use disorder, what is your advice to the families of those people?
First and foremost, that my heart goes out to them. I know that it's a very, very difficult time. One of the things that I would really stress is to educate themselves about the illness, about the misuse of drugs. Education, knowledge is power. You know, one of the things that tends to happen is that people start to internalize the stigma or you know, believing that they did something wrong. You know, and I truly believe that through education, they can learn that that drug dependence, drug misuse doesn't know socioeconomic barriers. It doesn't know color. It can happen to anyone, and that it is not their fault. I would also encourage them to remember their loved ones as their loved ones and not judge them by their behavior. That this is an illness, that this is a chronic medical health condition that could be treated, and that recovery is not only possible, recovery should be the expectation.
You know, we talked in the interview about your family, but you also wanted to point out a lot of them are regular, good, hardworking people who loved you through every bit of your life and everything that you've been through.
Yeah, thank you for saying that, Jay. You know, the statement that I made in our earlier interview about, you know, some of my families being drug dealers is true. But the majority of my family, especially my parents, are hardworking individuals who, as a matter of fact, they've been married for 60 years. They raised a family together. You know, both my parents work. They dropped out of this school at the 8th grade so they can go to work, and they stress education. You know, and so I want to honor my family because not, you know, they are hardworking, good American people who raised their family the best that they could with what they had.
Tony, the last thing I would like to talk to you about, and for you to take us out on this note in our last minute, is you say recovery is available to us all. Talk to me about that. Recovery available to us all? Because for some people, I think they feel that it's not within reach or they can't get access to resources. So talk to me about that.
Well, I mean, we know even through this pandemic that we're in now, we can see the health disparity. However, recovery is everyone's responsibility as well. And recovery should be available. If it is a medical health, if it's a chronic medical health condition, then why not make it available to everyone? And everyone should have the opportunity to recover. And it is our responsibility to make those opportunities available so that people could take their rightful place in their families, in their communities, in you know, and be able to live their best lives.